Hello and welcome to your very own channel. Today we will be discussing about the National Family Health Survey recently launched by the Ministry of Health and Family Welfare, Government of India. This topic is important because it will give us very extensive data that can be utilized for answering questions in civil services examination, and many questions can be framed for the preliminary examination from this data, and it will be a very rich resource from which questions can be framed as well as which can be utilized for giving answers, enriching the answers to score more in any competitive examination of written nature and also of multiple choice question type. So please do subscribe to this channel, do like, share and give your comments. The National Family Health Survey is prepared by a nodal agency, International Institute for Population Sciences at Mumbai, under the aegis of Ministry of Health and Family Welfare of Government of India. The present survey is fifth in the series, conducted during the period of 2019 to 2021. It means there have been 4 National Family Health Surveys already conducted in India. So let us see about the 5th round of the NFHS. What is National Family Health Survey? It's a large-scale multi-round survey. So conducted in representative samples of households. So the households in India are taken as samples for this survey. And what will be the size of the sample? That is some around 0.6 million sample households from 707 districts. They were surveyed during 2 phases of this 5th round of the NFHS. Thus, it is a multi-round, large-scale survey conducted in representative sample. The first survey was conducted in 1992-93. Though it is recurring survey, it is not periodic in the sense that there is no fixed period for its conduction. Like it's not a yearly survey, nor is it a decennial survey like the census. But then it is conducted time and again. The first survey was in 1992-93, the second survey was conducted in 98-99, third was in 2005-6, fourth was in 2015 and 16, and the fifth and the present one was conducted during the time period of 2019 to 21, and the second phase has been recently completed and the data has been put in the public domain. So questions can be framed out of these facts in preliminary examinations. The National Family Health Survey 4th round, it for the first time included all the 6 union territories. Otherwise, the surveys do take place in all the states, but from 2015-16 onwards, that is from the 4th round, the union territories have also been included in this nationwide survey. What is the goal for which this survey is conducted? There are 2 specific goals. One is with regards to policy and programming. So in order to make policies, in order to design policies and programs, the government needs data. And this pertains to the data on family and health. So the goal of this survey is to provide essential data on Health and Family Welfare needed by the Ministry of Health and Family Welfare and also other agencies in India. And the second specific goal is to provide information on emerging health and family welfare issues. So one is data, the other one is information on emerging welfare issues. So keeping these two specific goals in mind, the agencies are involved in conduction of survey, and they are as follows. The nodal agency, as already seen in the first slide, is International Institute for Population Sciences at Mumbai. It conducts the surveys with the help of field organizations that are responsible for actual survey, the implementation of the survey, visiting the households and asking them questions and getting the data. Technical assistance, on the other hand, is provided by ICF in USA. This is a consultancy firm, and a technology service provision is done under this ICF USA. And other organizations on specific issues, they provide technical assistance. And the funding part is being taken care of by USAID, the Department for International Development of United Kingdom, the Bill and Melinda Gates Foundation, the United Nations Children's Fund, the United Nations Population Fund, the Ministry of Health and Family Welfare, and the Government of India. So these are the agencies that provide funding to the nodal agency to operate through the field organizations, and the technical assistance is also being provided by organizations like ICF. So all these together conduct the survey and provide us data and information for policy formulation. And the data on following items are essential for policy formulation. So this survey provides state and national information on fertility. Fertility refers to the number of children that would be born to a woman in her productive age. Total fertility rate, for example, is the specific information which is gathered from this survey. It helps in analyzing the trend of the population growth and designing policies accordingly. Likewise, the data on infant mortality and child mortality is also provided. Infant mortality relates to the mortality of the newborns before attaining the age of 1 year, and child mortality, on the other hand, refers to the mortality of the children below the age of 5 years, under 5 years. Likewise, the data provides us information on family planning practices, the trends, and the other details regarding the practices, contraceptives, etc. It provides data about maternal and child health, reproductive health, data on nutrition standards, data on various diseases like anemia, HIV, AIDS, tuberculosis, malaria, and non-communicable diseases, etc. And also it provides information regarding utilization and quality of health and family planning services in India. So getting these data is very essential at state level and national level for formulation of programs and policy. So what are the findings of this present fifth round of the National Family Health Survey? There are many positive things that have been noted by this survey, and it's very enriching result for India, as the survey has found that India's population has stabilized. It means there is no more population explosion. The growth rate of the population is such that the addition to the population is balancing the number of deceased, and as a result, the curve of population growth has achieved a plateau. So there is stabilization of the population. The total fertility rate is now 2. It means that total fertility rate is an indicator which shows how many children are born to a woman in her reproductive age in India. So the average number of children that would be born to a woman in her reproductive age or in her lifetime is 2. That is, for a couple there will be 2 children, and the replacement rate is 2.1. So our TFR is just below the replacement level of 2.1. Once we achieve the replacement level, it means that the total addition in the population will be equal to the total number of deaths in the population during a particular period. So if we compare this TFR with the previous values, we will see that this TFR has decreased from 2.7 in 2005-06 to 2.2 in 2015-16, that is during the 4th round of the NFHS, and presently it has decreased from 2.2 to 2. So it is a positive achievement. Likewise, the sex ratio, which is the ratio of the number of females to the number of males per thousand population, that is also improving, and it has turned out to be in favor of women in this NFHS 5 findings. So now there are 1020 women for every 1000 men. This sex ratio used to be low, but now it has improved in favor of women, which is a very healthy sign of development. The sex ratio again in 2015-16 was 991 female per 1000 male, which has now become 1020. Otherwise, in the past, it was only in the state of Kerala that the sex ratio was in favor of women. So the reasons can be migration and birth. The overall condition for women is good, that can be inferred from this sex ratio. The other indicator is India's sex ratio at birth. So this needs to be contrasted from the general sex ratio. Sex ratio at birth refers to the number of female compared to the number of male per thousand population at the time of birth. So this figure is 929 girls per thousand boys. This figure in the 4th round was 919. So there has been an improvement in the sex ratio at birth as well. Likewise, the survey has found that now institutional births have increased. It means the women are now preferring to give birth to children in facilities like hospitals and healthcare institutions, are not at home. So this is also an important development. So institutional births account for around 89% now as compared to 79% in the past. So this is also a positive finding. Now with respect to malnutrition, the survey has found that all the forms of malnutrition, namely stunting, wasting and underweight, they have shown overall improvement across India. Stunting refers to a child having low height for his age, lower height than standard normal for his age. Then he is said to be stunted in growth. Likewise, wasting refers to low weight for his height. So if the average weight is less for a person, for a child of a particular height, then it is said to be wasting. Likewise, underweight refers to low weight for a particular age. Okay, So all these three forms of malnutrition, they have shown overall improvement. So overall, the NFHS fifth round is giving positive results. Yet again, it has found that child marriage has come down. However, it has come down only marginally. So this menace of child marriage is a cause of concern that still remains in our society. 78.6% of women have their bank account. Janadhara, the Prime Minister's Janadhan Yojana has paid fruits. So the survey has found that 78.6% of the women have their own bank account. Likewise, the survey has also stated that the access of women to clean fuel, sanitation, and other facilities have also improved across India. Women's say in decision making. This is an important aspect of women empowerment. So it says that the say of the woman in decision making related to healthcare and major purchases for the family has also increased from 73% to 92%. It's almost nearing 100%. So the decision making power is also being transforming in favor of women at household levels, which is a very positive sign from the societal perspective, from the woman empowerment perspective. So all these findings can definitely be written in the general studies answer, in the ethics answers, in the essay, and also you can frame out questions for preliminary out of this survey. However, not all things are positive. There are certain concerns also that the family health survey fifth round raises. And the concerns can be stated as follows. That the sex ratio at birth that we have seen to be 929 girls per thousand boys. This is skewed towards boys, definitely. Less number of girls are there for 1000 boys. And what WHO, the World Health Organization, prescribes is as natural sex ratio at birth is 952. So India in this particular indicator is less than the natural SRB prescribed by the WHO. So there needs to be steps taken to improve this indicator. So there can be a question out of this. What steps could be taken? So you need to mention the present situation, though it has increased from 919 to 929. However, it must increase to at least 952 in future. Likewise, on the aspect of anemia, the survey says that there has been poor performance in dealing with anemia, that is iron deficiency. Iron deficiency is a problem pertaining to women in particular in India. And the survey says that we have not done good in this particular field, as the incidence of anemia in under 5 child is around 67%, and it has increased in fact. Amongst women, the anemia accounts for 57% and amongst men for 25%. However, there has been an improvement, not an improvement, there has been an increase in the number of incidents. So there has not been any improvement in this scenario. It has in fact worsened in all the states across India. That is the finding which is disheartening. And only Kerala is the state that has got low incidence of anemia, but all other states are in severe category. So this is a cause of concern and alarming situation which needs to be dealt at policy and program level. Likewise, the survey has found that the proportion of overweight children, women and men is also increasing. Obesity, for example, is increasing, and this indicates that there can be more non-communicable diseases like heart diseases, coronary diseases, and lifestyle diseases. So there is an indication that we need to focus not only on the communicable diseases like the corona, but also on the non-communicable diseases. So this gives the framework based on which the policy needs to be directed and framed. Other causes of concerns are the domestic violence. So the survey has found that there has been increase in the domestic violence, spousal violence, and it has doubled from 20% to 44%. So this is very alarming. On the one hand, we see that the woman empowerment has been there because the decision making power has gone in their favor in the household level. But at the other side, in the society, still this domestic violence is a menace. So we cannot say that women have been empowered in reality. Still, the patriarchal mindset of the people in the society prevails, and it goes against the interest of female. So all these points can be very importantly mentioned in the GS answers and essay. Likewise, the survey finds that limited male engagement has been there in family planning. It means that the engagement of female have been more, and the male have shown lesser tendency to engage in any family planning techniques like contraceptives, operations, etc. Females bear the burden. Female sterilization continues to dominate as a modern method of contraceptives. So these are the causes of concern. So if the question comes as to what needs to be done in various areas, you need to cite these findings of the survey first to give evidence of the situation prevailing in the society, and then we would go on to give solutions to make a change for better in these situations in the society. This is how the answers could be framed. So it's a very enriching content. With respect to the survey now, though it has given both positives and negatives, and positives are very encouraging for India. However, the issues that remain with the survey in particular are that the sample size is very small as compared to the population of the country. 0.6 million households are only taken as the sample size across India, across all the states and union territories. So sample size needs to be increased. Then the survey does not have data on micronutrients. Micronutrients data is essential, but that data is not covered by this survey. It gives the status of nutrition in a broader perspective, but does not say about the deficiency of micronutrients minerals across children, women, and men in India. This needs to be addressed. Then the data of the phase 2 of the survey was conducted during the COVID-19 pandemic period. So there is a great possibility that there has been undercounting of the incidences. The households may not have reported the questions properly. There could have been great lacunas because of the prevalence of pandemic, and also the pandemic in itself was too taxing for the people. So the analysis or the results that the survey has given regarding the diseases and the nutrition aspects may not be proper. This is what the critics have got to say. Then there is anomaly in the data also, because two phases of data are available for this fifth round. So if we compare the data of the first phase with the second phase, many anomalies can be pointed out, and therefore the critics, they say that there is a question over the reliability of the data also. For example, the TFR is 2. How that TFR came to 2, whether we can rely on this data or not, that also is being questioned. So this is in short the discussion about National Family Health Survey. In this video, we have seen the findings, both the positive and the negative, and the issues that can be raised with this survey. And once we have given the issues, we can easily say that we need to address these issues and move forward. So the way forward would be removing all these bottlenecks in the survey to make the data more concrete, more reliable, and also we can say what policies needs to be framed so as to remove the shortcomings which the National Health Family Health Survey has pointed out, especially with respect to anemia and women empowerment, with respect to the patriarchal mindset in the society. So please do share, subscribe, comment, like, and keep watching this channel for important videos on current affairs that can enrich your preparation for UPSC civil services and other competitive examinations. And do visit, sign up, login the website to get access to various test series and other programs that are being conducted for you. Thank you and all the best.